At the same time, Singapore's COVID-19 task force has announced new measures to allow for more vaccinations at a faster speed. Included are more vaccine alternatives and more groups who will be able to get their shots. Shalin Sia joins us live for more on this. Shalin, what are the latest updates on vaccinations?
So private clinics will soon be allowed to bring in and administer WHO-approved vaccines under the Health Ministry's special access route. And these include those other than the mRNA vaccines like Pfizer and Moderna that are currently available in Singapore. Now, under this route, COVID vaccines such as AstraZeneca and Johnson & Johnson could soon be available, even though they aren't yet authorized by Singapore's Health Sciences Authority. Now, the task force says it's to provide alternate options for people who cannot take these mRNA vaccines provided in the national vaccination rollout, and that's due to medical reasons. Now, the Health Ministry says it will take the lead from the WHO for vaccines approved under its emergency use list. And let's have a listen to what Minister Ong Ye Kung had to say.
There are only a handful of vaccines in the WHO EUL, as I mentioned earlier, is Pfizer-BioNTech, Moderna, the two which we are using for our national vaccination program. In addition, there is J&J, Johnson & Johnson, Sinopharm, and then AstraZeneca. Yeah. So, of course, there are many other applications before WHO now, one of which is the Sinovac vaccine. If WHO approves the Sinovac vaccine into the EUL, then a healthcare provider can apply to have access to use the 200,000 doses that we have and then use it to administer to individuals in our population who wants to have it.
Now, the task force also said that these vaccines will not be free of charge, and private healthcare providers will be the ones pricing the cost of these vaccines. But it also says that it will continue to explore such alternatives for the nationwide rollout beyond the current Pfizer and Moderna ones. Now, we earlier heard that students aged 12 to 18 will start registering for their vaccinations from tomorrow. But more groups of people will also be allowed to get their shots. The task force says this includes those previously deemed medically ineligible, such as pregnant women and breastfeeding mothers. Now, restrictions have also been lifted on cancer patients undergoing treatment, but that's of course subject to doctors' approval. And now we should note that these updates come as we're just 2 weeks away from June 13, which was the scheduled end of the Phase 2 heightened alert. Now, the task force is cautiously hopeful that the situation can be controlled, barring any super spreader cases, but they do urge Singaporeans to continue to do their part to bring community cases down further. Now, let's hear from Co-Chair Lawrence Wong.
It's very unlikely on 13th of June that we will go all the way back to Phase 3. We will have to do this gradually and in a controlled manner. So there is some chance of relaxation, but in a controlled and calibrated manner.